everyone, I'm Stephanie with 9 Health, and this is Health Happens, the show we do every Tuesday to bring you objective, real health information. And today we're talking health insurance. I'm with Monica Caballeros from Connect for Health Colorado, the main insurance marketplace for Coloradans. You can get tax credits, help paying those insurance costs. It is the place to go when you need some health insurance. So let's get right into it. First, tell us, what is Connect for Health Colorado?
That's a great question. I think that we think everyone knows about who we are and what we do, but
I think people have heard of it, but
exactly.
maybe they don't know or haven't had to use it.
It is the official health insurance marketplace for Colorado, and so it's the only place where individuals, families, and small businesses can go and qualify for a tax credit to lower their monthly premiums. And for those who have lower incomes, they may even qualify for additional healthcare discounts to make their copays and deductibles more affordable.
Okay, and I'm going to be checking my phone just to make sure, one, that we're on and that everything technically is going well. And if you have any questions, just post them in the comments. I'll get those answered by Monica. So we talked a little bit about what Connect for Health Colorado is. Why should someone, if they need health insurance, why should someone consider shopping through the Connect for Health Colorado marketplace?
That's a great question. So I think other than those tax credits that you can get that are only available through Connect for Health Colorado, shopping through Connect for Health Colorado means that you are enrolling in quality coverage. All of the health insurance companies that we work with and all of the plans that we sell must meet the requirements that are set forth by the Affordable Care Act. So that means that you can get those preventive services at no cost, and they must be covered under every single plan. Okay. And that means that every plan is going to offer 3 visits to your primary care doctor at no cost. And so there is these essential protections and benefits that are really built into all of the plans. Okay. And then what is also an advantage is that you can compare against various health insurance companies, the different levels of plans, and so you really have a lot of choice.
Right, and this is all you can see on their website. I'll pull up their website here. You can find all of this on their website, compare plans, get started, find the financial resources that you need. All of it is on your website.
That is right.
There's also a great FAQ page just explaining, we've talked about, so we've done health insurance all September. We've talked about different health insurance terms that you might need to know, different plans, but the FAQ page on your site is a great resource. I've found just when I need to clear up some
that's right.
terms and what does deductible mean, what is, all these different things mean. But someone did just say, Medicare's all I need. So you explain again that at Connect for Health Colorado, it's really not for Medicaid, Medicare. It's those traditional health insurance plans.
You got it right. So the marketplace is for folks who don't have access to healthcare, perhaps through their job, and or who cannot get it through a federal or state program like Medicare or Medicaid. So unfortunately, you cannot purchase a supplemental plan for your Medicare through the exchange. Okay. But what I do want to address is that for those who have perhaps rolled off of Medicaid because their income has increased, you could actually come onto the marketplace and qualify for a lot of savings to lower the cost. And so if you are someone who perhaps has had Medicaid in the past and isn't able to get it any longer because of your income, I really encourage you to check out how much financial help you can get through the marketplace.
Okay, and is that pretty easy to sign up for?
Yes. Okay. So in addition to having our website that has all of these
that
has all of these great resources like those FAQs you were talking about,
and it's connectforhealthco.com, right?
You got it. connectforhealthco.com. And we have a few different tools, so you can use our quick cost and plan finder, and that lets you put in just a few data points and be able to see all the plans available to you in your area. And so it takes just a matter of minutes. You can filter according to what matters most to you, like your covered doctors, the facilities you go to, your prescriptions. And then, of course, being able to filter by cost and the yearly cost estimate of your plan, because we know you really want to think beyond that premium. Okay. And another really important area that you'll want to check out is our We Can Help page. So let's say you're someone who is thinking, I don't want to do this all by myself online, no matter how easy it might be. I'm not an internet person, let's say. We have expert in-person help all across the state. So we really partner with community-based organizations to certify individuals who can help you apply for financial help and take you start to finish through the process.
So you don't have to just go to this website and do things on your own.
You got it. There's lots of help. We have over 700 certified brokers who can also, in addition to helping you go through the application, apply for financial help, they can recommend what plan might be best for you based on your medical needs and your budget.
Okay, great. So I mentioned open enrollment starts in November, so it's kind of good to start researching now, figuring out what you need now. Can someone purchase a plan sooner? Explain how that works.
So the open enrollment period does start on November 1, but you can get signed up today for coverage starting the first of the following month if you've experienced what's called a qualifying life change event. And so what some of these are getting married or getting divorced or losing your coverage from your job because you lost your job, and that could have been that you involuntarily lost your job or you decided to quit and maybe start your own business, and so now you no longer have access to that job-based coverage. And as I mentioned earlier, losing Medicaid is a really important one, and so those are just the really common events that allow you to come into the marketplace now, report that you've had this changing event, and that will allow you to shop for a plan that starts before January 1 of 2020.
Okay, so otherwise, if you haven't lost your job, you haven't gotten married, no major life change event, November is when you enroll for coverage starting January.
You got it.
Okay.
So November 1 is the first day someone can come in and sign up for January 1 coverage.
Okay, and we've kind of touched on this, but who can sign up for a plan with Connect for Health? And someone did ask on Facebook, will it help a person on SSI, disabled person on Medicaid? We've kind of talked about this is different than those programs, but maybe touch on that again.
That's a great question. So anyone who is a resident of the state of Colorado can sign up for a health insurance plan unless you're Medicare eligible.
Okay.
But if you are already covered through a Medicaid program, for example, if you have a disability, then you would be covered under that, and you wouldn't shop through Connect for Health Colorado.
Okay. And any other, as far as who can purchase a plan, you said pretty much anyone?
Pretty much anyone. The caveat is that not everyone will qualify for the financial help, but as long as you are a lawful resident of the state of Colorado, you can buy a plan. So some of the more common scenarios I see is folks who have their permanent resident card or maybe their work permit, but they don't qualify for Medicaid because of that status, even though their income might be lower. They can qualify for tax credits through the marketplace. And so just want to make sure people know that even if you are an immigrant, you can still apply for health insurance through Connect for Health Colorado.
Right. No, that's great to know. And what help is available for people who, let's talk about picking a plan.
Yes.
Who need help picking a plan. Someone did just ask on Facebook. Matthew said, I already like my plan. Do I have to shop? I don't think you have to shop. You can if you want to. Maybe there's something else out there. But just talk about how the help available to pick a plan and compare plans.
So in addition to our online tools that can help you really compare about those prescription coverage, the formulary, your primary care doctor, your network, which is really important, we have that expert in-person help. And it's so important this year, it's important every year to shop. Because even though plans and prices change every year, we know that people's family situations can change. And so maybe you need a plan that's different this year because you don't have some people in your household are no longer in your household. Or so that's just one example, but I really encourage people to check out that in-person help available because those certified brokers can make sure that you're thinking about more than just the premium. A lot of plans that might have a lower premium will have a higher deductible oftentimes, and you might have to pay a little bit more before the health insurance company starts sharing in the cost with you. And so by working with maybe a certified broker to help you shop and compare plans, they can really help steer you toward what is going to work for your budget in the next year.
Okay, yeah, someone did just say, it's all too expensive. So maybe we just touch on, people come on and off on Facebook Live, maybe just touch on again the tax credits and the financial help that is available. And is it hard to qualify for?
So all you need to qualify for financial help, you can get a quick estimate on whether you qualify using our online tool, the Quick Cost and Plan Finder.
And we'll put a link to their website in the comments so you guys can click through that and see that resource.
And in addition to using the Quick Cost and Plan Finder, I think a lot of folks think that they earn too much to qualify for financial help. So going into 2020, a family of 4 that makes up to $103,000 a year can qualify for tax credits. An individual who's making up to about $50,000 can qualify for tax credits. So even if people think that they don't qualify, it is pretty quick and simple to use some of our tools to just get a snapshot. Or if you don't want to go online, talk to maybe a certified expert who can really help you understand what plan is going to meet your needs.
Okay. And we talked about open enrollment starting in November unless you've had a major qualifying event
That's right.
like marriage or some other examples now. I'm drawing
Divorce, having a
marriage,
baby.
divorce, having a baby, other issues that have come up. Unless you have a life-changing event, it's November 1st.
That's right.
So tell us before we wrap up here, what else can people do to prepare for open enrollment as it approaches?
I think it's important to start asking yourself questions about what you really need in a health insurance plan. So what sort of prescriptions do you get that you'll want to have covered in a drug formulary? Who are your core team of providers that you have to be able to see? And so I think by starting to think about these things and writing some of this stuff down, what's important in a network, and that goes back to who are your providers, who's your specialty care,
right.
And then of course thinking about the cost. And how much you would be able to pay at most for a copay, and how much you think you can budget for a premium. And that way, when you're coming into Connect for Health Colorado on November 1, whether you're online or if you're working with somebody in person, you can kind of have that list of the important things that are important to you that will help you protect your finances and your health ready to go.
Okay, awesome. All good information. Thank you so much for joining us. Again, this is Monica. She's with Connect for Health Colorado, and we'll put the link to their website in the comments. connectforhealthco.com. I always want to say Colorado, the whole thing. But you can find lots of information there about picking an insurance plan. It's a great resource, and shop for your plan there. We've talked health insurance all month thanks to Connect for Health Colorado, the marketplace for health insurance in Colorado, and the place to apply for tax credits and financial help. So thank you for joining us. We're going to sign off from here, but if you have any additional questions, post them in the comments, and we'll get those answered by Monica as well a little later.